Welcome to this very special live session that we are having today, part of a very special cause and part of a very special campaign that we're running on Instamojo, which is the mental health awareness campaign, which is also, the month of May, which is the month of mental health awareness. And today on this very special live, we have with us Dr. Supriya Malik, who is a psychologist and the founder of eMbrace Lives, a mental health organization dedicated to make therapy services accessible to everybody. She's been working in this field for the last 15 years, and she's very passionate about working with children and young adults, especially. Dr. Malik was also awarded the Business World 40 Under 40 Award for her contribution to healthcare in India. Lovely having you here, Doctor. Thank you so much for taking time out to talk to us about this very special, this very special cause and this very special live session that we're having today. So over to you. Please take the stage. It's yours.
Thank you so much. Thanks, Ken, for that really nice introduction. Hello, everyone. I'm glad that we're actually having these conversations around mental health. The Mental Health Awareness Month. I'm hoping that it's doing its job, where we're actually pushing people to think about mental wellness, mental health, and at least talk about some of these topics in a more conscious manner, I would say.
Right. Wonderful. So, just to get the conversation started, maybe I guess we could start with the simplest question, which is, which many people still find it very difficult to answer. What exactly is mental health, doctor?
So, mental health is just, all of us feeling that in our mind, when we're thinking, when we're sitting with our emotions, when we're sitting with ourselves, we're comfortable with how we're feeling, how we're thinking, the space that we're in. All of us go through, ups and downs in life. So, of course, we're going to go through different feelings and emotions. We are going to have stress. We are going to have sadness. We'll be frustrated at different moments. So that's all part of, being a human being. But I think mental health takes it a step further, where we're trying to, help people understand that it's about making sure that those emotions we are being able to manage. Right. Just like our physical health, we have pains, we have injuries, we go through our physical ups and downs. We go to the doctor and we're able to manage them better. So in the same way, when we are dealing with big emotions, when we're dealing with difficult emotions, when we're dealing with difficult states that we're going into, difficult settings that we're going to, it might be useful to have someone who can help us through those difficult states that we might be going into. And that's what I would say mental health.
Right. I'm sorry, doctor. I think you broke up a little bit over there. I'm not sure if it was my connection or yours. I think now it's better. I don't know if it was my connection or yours, but I think we're back to normal now. And I think we were also at the end of that particular question, where I think you summarize it really, really well. And I think most of us, at least I hope so, if everybody in the comment section could let us know if you all could hear what Dr. Supriya just had to say. So I think that's a wonderful way to summarize in very layman terms what mental health exactly is. But I think I would have a question as to, you mentioned, you spoke about how when we're going through a difficult phase, or, we're trying to process difficult feelings, how exactly would you identify if you're going through a phase like this, whether or not it's like, when do you realize that it's difficult only for you and, it's not just generally difficult? Because, once, if somebody, let's say, hurts, they fall down and they hurt their knee, it's a general pain that that another human being also would feel, right? Because that's the pain everybody would go through. But I feel like with feelings and issues related around mental health, I think are very personal. So how does one individual identify as to okay, this particular thing is maybe difficult for me to process? Because I feel like most of us, we just sort of try to power through it, and we think that, oh, it's probably it'll just pass, and stuff like that. But I think it's important for us to identify. So maybe if you could shed some light on that.
it's sometimes very difficult to identify when you're going through it.
Right.
And that's, I think, the case with any difficult situation. When you're in that difficult situation, to really take a pause and process and think about what's going on, it can be quite challenging. But some of the giveaways, or some of the things that one can keep in mind would be, we often see this general lack of interest that starts coming in activities that were previously enjoyable. You know, so I might like to cook, and slowly, it's not necessary that it will happen suddenly. It's like a gentle, fading that can also come in with difficult feelings, with difficult, situations. You just don't feel like doing things that you are interested in, right?
Right.
So that's one of the things that happens. Oftentimes, sleep gets affected in people. You're not sleeping well. Either you're sleeping too much or you're sleeping too little. For a lot of people, who are struggling with deep feelings, it can also be that concentration on a particular task or activity becomes, challenging. It's when I speak to a lot of managers, actually, when you're doing some corporate programs and you're talking to managers, that's one of the telltale signs that I talk about. Where I keep saying that those people that you have who are not being able to attend to tasks, check their mental health status, because stress often will lead to our attention wavering, and some of those then. Other times, people can also see themselves socially withdrawing from others, so not as socially engaged, not don't feel like going out to meet friends and family, want to stay by themselves a lot more involved in their own thoughts. And this could be, these are different experiences that one can feel from something like a change in job or losing a job, breaking up, losing a relationship, to even grief, so in that sense, these are subtle signs, but they are good giveaway signs for us to say that yes, now the person requires maybe an additional hand who can help them and support them through this process.
Correct. Over here, doctor, there's probably like one aspect of the scenarios that you mentioned, where let's say people, they're sort of withdrawing. They're not socializing as much. They're not meeting their friends or family or anybody for that matter. They're just basically containing themselves to just them. Let's say they are also able to identify that they're probably going through a certain phase. But in a situation wherein they don't feel like talking to anybody, how exactly could somebody reach out to help, like reach out for help, even if they want somebody's help, how exactly, what would their motivation be to actually do that, or how exactly does that scenario, because it's a little tricky. I hope I'm making myself clear.
Yes, absolutely, you are. Yeah, and that's actually bang on, because a lot of people who come and contact us would say the same thing, that I just didn't feel like talking to anyone, but I've done it because I think I can't deal with it anymore. And I think it's that last line with that phrase, I can't deal with it anymore. That's usually the time where someone is pushed and motivated to go seek help. Oftentimes, though, I do agree with you that it might be slightly later than when what we would have wanted. We would have wanted person to come in and see us a little earlier. But at the same time, I think the motivation often is, and this is how I encourage a lot of the young people who are coming to us to say, that just like how if I have to go get a blood test done, because I'm fainting or because I'm having a fever, I need to go seek a doctor. In the same way, if I'm feeling all of these things, I need to go see a doctor. I need to go see a therapist. I need to see someone who will be able to support me. But you know, it's a different challenge, and sometimes you also need other people around you to sort of push you in that direction, to gently nudge you to say, how about going and speaking to someone, because it's very hard to speak about some of these things within the family, to your friends. You're Generally, we're all very conscious of how and what the other person is thinking, right?
Correct.
So going in for therapy is actually quite safe, because in that sense the other person is neutral. They're not thinking anything about you. There are no judgments that are being passed. There are no opinions as such. So I think that's probably what I would say, but it is tricky, and I do accept that it's very hard sometimes to bring yourself out and start talking to people.
Correct. That's true. I mean, because even like in my experience, of course, even I've had such phases wherein I've been through a difficult phase, but it was very difficult for me to, even though I was able to identify that maybe this is something that I will need help with. Not, I mean, not necessarily professional help, but at least I need my friends or family support in this, and maybe they'll be able to push me in the right direction. If it is professional help, then that be it. But yeah, I mean, as I mentioned, it is tricky. So doctor, my next question, or the next topic that I probably want to touch upon a little bit, is that there's no one universal cure for a situation like this, or because everybody's situation and scenario will be unique and different.
Sorry,
So
someone messaged saying that I have a fear of people, and in that case, the accessing therapy sometimes can be very difficult and challenging. But I do want to mention, and sorry, I'm pausing there because I do want to address
no,
that.
no, no, so
We
I'm
do,
clear.
yeah, we do offer therapy. We offer something called chat therapy, and where you are still with a therapist. For at eMbrace, we don't follow the AI chat bot sort of a model, because I don't think that we can add that human touch to it when you're talking about AI, and it's a controversial topic, so I'm not going to go there. But we have chat therapy where you can chat with the therapist in the appointed time, and that way the human interaction, of course, is reduced. You can feel comfortable but you can also still get the support that you require. So that might be a way for people to also access therapy.
Yeah, I think Sangeeta had asked that question, so I hope that answers your question, Sangeeta. Right. No, no. So, yeah, I was just saying that, there's no universal cure, or, like a one fix for everybody, because everybody's scenario is unique. But if we had to sort of talk about cures in particular, would you say that there is a cure to mental illness, or, there is a cure to, I mean, I don't know. Like, I don't know how to even frame this question, but is there a cure to mental illness? And if there is, how long does it take? Is it a process, or does it happen overnight, or you know, does it have to be medication? And of course, we'll get into that also in our conversation a little bit later. But my question to you at this point is that.
Sadly, we don't have any cures for mental health issues. And if someone is trying to say that they have a cure, I'd probably listen to it with a pinch of salt. But we do have very good evidence-based, solution-focused solutions or treatment options that are available now, therapy options that are available.
Yes.
So yeah, so I was saying that we have some really clear line of therapy options and treatment options now available for specific mental health issues. And when we follow those protocols, that have been well researched, that have a big scientific evidence behind it, we know quite often that we are going to see similar results as research, where people are going to feel good about themselves quite quickly. At the same time, we know with some of the therapy options, we don't see a lot of relapse happening. We are able to control for that also, that you've gone through a particular difficult phase, and if you've gone into good evidence based, gone into therapy with a therapist who's using evidence based practices, the likelihood of you having a similar problem later on in life reduces drastically. But again, like you said, yes, it's often a mix of medication along with therapy. What kind of therapy that you're going for, all of that, varies from disorder to disorder, mental health issues to issues. And that, is the process that a good psychologist or a psychiatrist will be able to help you through.
Right. That actually leads me into my next question, doctor. What, like we were talking about, when people would want to reach out to basically reach out for professional help. How do they know whether they need to reach out to a psychiatrist or a psychologist, and what is the basic difference between the two? Because I don't think most people would know that.
Yes, absolutely. We get lots of confusing requests like that as well. So, psychiatrists are those who have an MBBS degree. They are doctors through MBBS and then have a specialist MD degree in psychiatry. They can prescribe medication, whereas psychologists don't follow the MBBS path. Psychologists have a separate bachelor's and a master's and a PhD program that they have to go through, and we cannot prescribe medication. Therapy is often practiced by psychologists. All the counseling services, the therapy services are often practiced by psychologists. There are some psychiatrists who they do get trained in their psychiatry training, but some of them take it forward and go in depth and learn the full therapeutic process, whereas some psychiatrists do not do that, and they only stick to prescribing medication and diagnosis.
Is there a process that a certain individual would have to follow, that okay, maybe I need to see a psychologist first and maybe then a psychiatrist? Because there's also a notion, at least from the conversations that I've had in my circle and with my friends, the common notion, at least among them, is that when it's medication related, it's really serious, and when it's not, then maybe it's not that bad. So that's just the common notion, which I'm pretty sure is not backed by any valid sources. But is that true? Maybe you would be the right person to actually bust that myth, if that is one.
I do think it's a myth, because severity levels, the way you're experiencing, how intensely you're experiencing difficult situations and emotions, it does not determine how whether you need medication or you need therapy or you need both. We know, now that for, say, anxiety issues, the combination of medication with therapy is what helps prevent later relapse. We also know that for depression, if it's the first time you've experienced clinical depression and you're going through some really low phases, then again, it's that combination of medication with therapy that will prevent later relapse. But having said that, oftentimes the first prescription would often be that try therapy, because therapy would be something that has long lasting effects, because you're learning how to rethink certain ways that your brain is used to, or reevaluate the way you're feeling. So that's the therapeutic process, and that can have some really long lasting effects, and that's why a lot of people would say let's try therapy first, and then if the therapist feels that no, they need the medication support, the therapist will recommend that. But oftentimes in India, when you're going to a GP or your specialist doctor, family doctor, they might say go to a psychiatrist first, because they are comfortable with that line of treatment. So it depends on who you're talking to.
Right. So, I mean, again, it comes down to individual preference and maybe like a case-to-case scenario. I'll go tell my friends that actually they need to know that. Doctor, also now in 2023, I mean, of course, there was, this entire, the last 2, 3 years were particularly difficult for all of us, everybody included, like people who were considered mentally strong. Because again, I'm speaking from a very personal, experience standpoint, because I've seen my friends, I've seen my family members who were always very, considered mentally strong, but I saw them also, I saw their vulnerable and weaker side as well, because the pandemic was so grueling. So my question at this point is that, many people have suffered in multiple ways, and, how exactly in 2023, because there's also ways to reach out in more ways than one at this point. There's also online therapy, there's also offline therapy. So is there a difference between the two in terms of the impact that it has on the individual?
Um, you're right. I mean, I think pandemic was harsh on every one of us, and mental health issues have
Right.
definitely increased as we've gone through the pandemic, the lockdowns that everyone went through. But so coming to that question of online therapy and in person, um, when we're looking at something called cognitive behavior therapy (CBT), we know for sure with years and years, not just recent, but years and years of research, which says that the effectiveness of therapy online versus in person is exactly the same. It doesn't change.
Right.
Yeah. And that's the reason why online therapy has taken over so drastically right now, because we know that it's actually very effective. Um, at the same time, for certain specific issues that people might be going through, for those kind of things, we do need to see them in person. So, for example, if someone is having some very serious thoughts around killing themselves, I know that this might be a very sensitive topic for people who might be hearing this, but those are then you need to see people in person because you want to safeguard them. You're also thinking about people who might be going through psychosis or schizophrenia. For in those kind of mental health issues or mental health disorders, then you don't need to see the person in person because we cannot offer online therapy for them. It's not effective.
Okay. Yeah, that's the thing, like the reason why I was also talking about the pandemic and my personal experiences, because people from, let's say, my parents' generation, they don't really believe in therapy, or in fact, it's very, I think only now are the older generations warming up to the idea of, mental health illnesses, because for them, maybe it was a lack of awareness, or, maybe it was just the way that generation dealt with things. So it's very difficult to make them understand the importance of this. So the reason why I was speaking about my personal experience and the pandemic is because online therapy has, I think it'll be easier for somebody like my mother or my father to get them to do online therapy, because they're at least in the comfort of their maybe bedroom or their living room, and they're talking to somebody and they're able to whatever, speak their heart out. So for somebody belonging to that generation, or maybe somebody who thinks in similar ways from the younger generations, also could benefit from online therapy. But I think you made some really valid points where it's again, it's case to case.
Yeah, you're right. Because I mean, I didn't go into those benefits of online therapy, but what has happened with online therapy is that it's actually made mental health accessible, right? Like what you're saying.
Right. Yeah.
The people who were not open to going into a psychologist or psychiatrist's office because that just going in was such a barrier. Having it on your phone is so much easier. So it's discreet. No one needs to know that you're accessing therapy, and you're getting the support that is required. But you'll be surprised. We get the kind of people who've contacted us. We've had so many students who contact us. They've saved pocket money, that they get over the month. because their families are not going to support them coming in for therapy. So they save that pocket money and they're paying us, and we're trying to make sure that we're really student friendly. We're charging really little to them, and getting the help that they require. We also have, women who would contact us and they're taking therapy from bathrooms, and men sitting in their cars after office and taking, having therapy sessions because they don't want their families to know. So it's such a dynamic, but it's really nice that at least this way people are accessing help.
That's true. That's very true. Doctor, my next question would probably be, because we all, I mean, majority of our audiences who are watching us now and will also be watching this, at a later point. They are either, working professionals, or they're, either they're employed at a company or they have their own business. Thankfully, there is a lot of conversation around mental health now because the workload, I'm pretty sure, everybody was working just as hard in the previous decade and the decades prior to that. But since there's a lot more conversation around mental health now, there is a lot of awareness that is there now. But at the same time, how can me, let's say, how can I as a friend be there for, my coworker, my colleague, or even my friend for that matter, who I can see that, is going through a difficult phase? How can I support them? How can I be there for them?
I think the first thing would be what you just said, right? Making ourselves aware.
Right.
That's absolutely the first step, because if I'm not aware, I won't even know that the person is going through it, and I won't know then what to say, how to say, all those kind of things, right?
Correct. Very
So
true.
I think awareness is huge, and just learning a little bit about what these issues are, because they're all around us, now. And I think the second one would be patience. I think patience goes a long way. I know sometimes that mopey friend of ours can be very irritating, but it's nice for them to feel that this person is being patient with me, and then it's easier for them to get out of that state, right? Or at least be authentic about who they are in front of that person. So I feel that sort of patience is hard, I know, but would be quite useful to people who are going through mental health issues. I also feel that sometimes the language that we use in general conversations and with people around us who might be going through difficult times makes a huge difference. So thinking about, what am I saying to this person? Often telling a person, come on, get out of it, shake it off, is something that you've been through it. So you know that it doesn't really work.
Correct.
And sometimes it can actually go the other way for the person. It can be quite frustrating for the person as well. So I think that's quite important. The other, the one thing that I feel people could do a lot more is probably get out of their phones a little bit more. It's
That's going to be difficult for a lot of people.
yeah, yeah, and it's interesting how, because we're seeing in general, the culture moving more and more towards more towards the phone, and screens, whereas that human connection is really important for us to preserve our mental health. So I think somewhere that would be quite important as well, because only when we're actually attending and being and focused on the other person in front of us can we pick up that the person is going through something difficult.
That's very true. That's very rightly put, doctor. I think awareness is where everything begins. I think maybe 10 years, prior to now, I probably, obviously, like, definitely did not have the awareness that I do now, and I might have said so many insensitive things back then, which I, only realize now. So I think it starts from awareness, and it's really great that there is a lot of conversation around mental health awareness now. Doctor, like probably one last thing that maybe you could share with all of us is on a daily basis, what are some smaller things that we can adopt as maybe as habits. Of course, habits are they become a part of our lives over a period of time. But to start off with, maybe what are some small things that we can do just to be a little more mindful and a little more something that makes it easier for us to manage our mental health better, because it's not necessary for somebody to be mentally ill per se, but just on a daily basis, if we're able to manage our mental health better, I think, God forbid, if there is a difficult time that somebody is faced with, I think they'll be able to deal with it better. Because I don't think, again, I'm no professional, but it's just my personal understanding of it, that as we've already spoken about it, that the degrees vary of it. On certain days we feel low, and we feel low to a certain extent, where we feel like, okay, I don't feel like going out today. But on certain days it's really bad, where you're like, I don't feel like doing anything. I don't feel like eating or taking a shower. So I'm pretty sure, at least that's what happens with me. Again, like I said, I'm no professional, so I don't know if that happens to everybody. But maybe to sort of manage that better, what are some small things that maybe we could take care of or do on a daily basis?
I'd say the first would be routine. Routines really help,
Right.
especially in those days where you're feeling down and low, or just irritable and not wanting to do things. Just having a routine that you've already established, it makes the day easier to go through. So I'm a big supporter of routines. I talk about routines quite a bit. The other one would be, so you were talking about mental health. When we're talking about all of these things, I often talk about mental fitness. Just how you are taking care of physical fitness. It's the same thing that you would want to do for your mental health. So you're thinking of mental fitness exercises, like what are the things that I want to do, and I do think that somewhere it's hard that people meditate. I know that it's very tough. But even if you don't meditate, just having, say, 3 minutes of time just yourself, where you're sitting just by yourself, no devices, nothing that is distracting you, and just being with your thoughts, just that itself, I think, can be very powerful. The other thing that we often talk about is, exercise, because we know this, that some form of physical movement, some form of physical activity, it helps you get out of those low moods. And it's not even getting out, it also keeps you not going to very low moods. So, like you were saying, those degrees that we have, the person who's active in general, they're less likely to go through low phases, because physical activity has that effect on brain. So that's the other thing. And I do feel, I've already talked about human connection, and I feel that somewhere that's really important for human beings. Some form of social community, some form of social connect is something that we all thrive on in general. So I'd say that I know everyone's very busy these days. Life has become quite difficult in different sense, but having at least some form of connection with friends, even if it's one person, that you're chatting with on a weekly basis, but at least you have that one connect that you're trying to do. Right? So I think that also helps. It forms like a protective factor. It's a protective gear around you to make sure that you're not going through some very, very low phases alone. I think those would be the top ones on my head. Just thinking aloud.
Yeah, I think they're wonderful points, Doctor. I should have probably noted them down, but I will come back and watch this video again and take notes, because those are really, really helpful. And I think most people they often don't realize. Again, I will not say most people, I will say me. I don't realize many times that, oh, I haven't spoken to my friends in so long, because we're all working from home, we're all busy, we just work the entire day, eat, and then watch a movie on Netflix, and just go to sleep. And we just follow that routine, day over day. So I think it's only after a while that I realized that, oh, I haven't called my friends, I haven't met them in a while, and that's when we do that. So maybe these are really good points that we should maybe be a little bit more mindful about, and consciously work towards them. I think that's one, maybe that's the key term here, where we are conscious about these things that we do every day. Right. Lovely, lovely point, Doctor. Thank you so much for sharing those. And I think we're also at the end of our live session over here. Would you have any closing thoughts, something to conclude the conversation with?
I'm just really happy that Instamojo thought of this, talk, this Instagram live, and thank you so much for inviting us. We're all available, so whoever needs help, whoever is even questioning whether they want to or they should be trying therapy, or do they need this or not, come out, speak. We'll be able to tell you whether you even need to come in or not. Yeah.
Right. Please, everybody who's watching this now and who's also like people are going to watch this later, please do go follow eMbrace Lights. Thank you so much, Doctor. Thank you so much for speaking with us and taking time out for this wonderful, wonderful session. I have learned so much from it, and I'm pretty sure everybody who's watching us now and will watch it later also will take away a lot from this. Thank you so much. Thank you for your
Thanks
time.
a lot, Nikhil. Thank you.